Hi class, let's talk a little bit about the experience of dying and the experience of being in hospice, because we learn a lot from reports of hospice nurses about what the experience of dying is like. So first of all, let's just understand what hospice is. It is generally, it is not a place. Instead, it is more like a program or an institution. And for the most part, hospice comes to you. It is a service for terminally ill patients to receive what's called palliative care. Palliative care is care that is not designed to save your life, but care that is designed to help you feel better while you are in the process of dying. It is a skilled treatment to relieve your pain and discomfort. So generally speaking, they will come to you. Sometimes you can go to a hospice center and be cared for there. But for the most part, you are in your home and people will come to you. Hospice workers do not do anything to try to delay death. So if you have a heart attack and they're there, they're going to let you have the heart attack. You're not going to get chemotherapy. You're not going to get medications to cause you to get better. You would get medications to relieve your pain, to relieve discomfort. The whole focus of hospice is to make dying easier. There are two principles that are central to hospice care. Number one, the patient is king or queen. Their autonomy is totally respected. Their decisions are totally respected. If they want more morphine, they get more morphine. If they don't want to take a bath, they don't have to take a bath. They get to decide. Second of all, this is focused on family members and friends. Family members in particular are counseled, provided counseling before the death and after death. They are given grief counseling services for quite a while after the death. They are also supported in providing care to their loved one. They are shown how to care for the person, and hospice is there to support the patient and the patient's autonomy and decisions, and they're also there to support family members or friends who are caring for the person who is dying. Hospice cares for something like 200,000 terminally ill Americans every year. They did a study on of hospice workers, and the hospice workers know when it's close, and they will tell the family because there are signs that somebody is getting close to dying. For 2 or 3 weeks prior, they start to show signs. Here are some of the signs: drifting away from consciousness, sometimes called straying over the border, so sort of in and out of consciousness. Here's an interesting one. They might make references to death, sort of cryptic references. They might say something like, "The bus is here, I'm ready to get on." I've heard some really interesting ones from my students, many of whom provide care to people who are dying. So ask around. I'll bet your, excuse me, I'll bet your family members have experienced something like this. Sorry. I'll bet your family members have had something like this happen. They might also start to see people from their past. So they might start to talk to somebody and they'll say, well, Uncle Joe's in the room, or my brother, there he is, and start to talk with them. They may stop eating or drinking. The skin on the knees, feet, and hands sometimes become purple and mottled, and then it's really common for breathing to become labored, which is called apnea. So hospice workers are experienced with this, and when they see those signs, they will kindly and gently tell the family members what's going on so that they can be prepared. Hospice workers report that the moment of death in hospice is often surprisingly peaceful. Sometimes they even describe it as blissful. They acknowledge that pain and trauma precedes it, but the moment itself of death is often calm and blissful. One hospice nurse reported that in 10 years of work, she had only ever seen somebody die in agitation one time. So that's encouraging. All right, that's just a little bit about dying in hospice for you. So look for those services when those times come in your family.